these big holes in our thinking all over the place. And if we're going to standardize or improve, then we're going to have to show our outcomes, all of them. We're going to have to own failed outcomes. And I don't think failed rehabilitation syndrome is something that some of the doctors have put at us, that's saying that we don't have to ever accept responsibility for putting bad physical therapy through and then someone ultimately have surgery. So how do we wrap our heads around those things? I know you and I run into, and I know you do too, Danny, where I have run into a patient who has been given really disenfranchising information. They've been told that they have a slipped disc, quote unquote, that there's a neuro physician out of Australia who's a good friend of mine, and I think it's like Libretto77. It's his handle, and he likes to take on the fact because he's coming in from as a physician, seeing people with pathologies that are really require some surgical intervention. And he makes a really good point. I don't think he's very popular among the physical therapists, but he is a lifter and he has a movement-based rehab center in his hospital. So he gets people moving again and sees that a lot of the problems, he's come to believe that a lot of problems he sees are movement dysfunctions. But his point is, how do we know if physical therapy has failed? And I think part of this scope of conversation is, how do we know if someone has gone through their 10 visits or hasn't met their goals? I mean, if we're talking about standardization, we have to know when physical therapy hasn't worked or when people have dropped off. And right now, let me ask you, Danny, what is your mechanism of reporting if physical therapy doesn't work? What you're frustrated around, Doug, is that there is zero transparency in how people, and especially the people who are virtual signaling or saying we should standardize, I can't, for the life of me, see what a session looks like for them. The thing that we all agree on is full range of motion in the shoulder joint, not, hey, everyone's a unique snowflake and every compensation is just a unique solution to a novel movement problem. Like, that's horseshit. And otherwise, if we apply that thinking out, it doesn't work. We teach kids to swing a tennis racket a certain way. We teach batters to sit a certain way. Like, we teach technique to people. Somehow with movement, it doesn't seem to matter. Refuses to move, sits all day, is sedentary. And at what point, who is responsible for that? And, giving someone a sheet or passing just, hey, by the way, this is probably in your brain. It's not really in your back and you're just stressed. That's not helpful. But I'll tell you, we're going to have to reconcile that dissonance, exactly what you're saying around, if we want to give credence to the fact that people are in different phases in their life. And by the way, this is the core tenet of being a coach, actually working with athletes, trying to do something. How do you feel today? What's going on? How are we managing your volume? Hey, looks like you're fried. I mean, we don't have any of those conversations. I don't think our profession is set up to have that conversation with people. Talk about nutrition, talk about sleep, hygiene, we don't. We just say, hey, look, here's a book. I don't know what to tell you, but this manual therapy isn't going to help you, right? And hey, manual therapy is terrible for low back pain, for chronic back pain. And one of the things that they're not a fan of that. It's hard to standardize that. And I was like, well, I think manual therapy is a real tool. It's not my go-to tool. And then I thought about people who have chronic low back pain in my clinic, and I don't use any manual therapy on them. And so I was like, okay, well, wait a minute. Why am I defending manual therapy? What am I doing to make someone feel better or have some input at home or teaching technique? But the first thing we do is teach movement and breathing, talk about how resilient they are and how they're...
Is that most of these things that we see, we can draw back to some sort of movement issue associated with that, right? How many people have you seen for elbow issues that are tennis related elbow issues, and people just, they'll needle their elbow. They show them all these different exercises to do, but yet they never talk about their swing or get somebody to look at their swing that actually knows what the hell is going on. So if we look at standardization, there needs to be a strong, compelling element for movement associated with that, because I think if it's not added, I didn't learn this stuff in school. I don't know. I'm sure you guys didn't either. Like, my first strong kind of element of movement analysis came from delving into to Kelly, to your stuff, like early on. And then all of a sudden I was like, dude, I'm missing the boat on all this stuff that we didn't learn in school. So if that's the case, then I think as a bigger question is probably, what are we not learning that we probably should learn that can make our profession better? Instead of standardization, what are some key elements that we just are missing? And I think movement, and I'm sure you too, Doug, knowing your background, like a lot of what you do, it doesn't really look like conservative physical therapy. And in many cases, I don't know if you guys feel this way, but I don't feel like I fit in with my peers who are other physical therapists. I seem to get along better and fit more in coaching environments, training.
Or understanding mechanics is an elective. So people aren't even being trained as generalists anymore in physical therapy school. So I think we have some real issues we're going to have to think about as a profession. What does it mean to be a physical therapist? How do we define that? And what is best practice? And is best practice different than specialization? Because what